support hospitals and clinics struggling to treat patients in the conflict-stricken region. Let's listen into what he has said.
We are in WHO warehouse in Khan Yunis. We just arrived with our medical cargo containing cholera kits, medical supplies, and other items that will be delivered in the next 48 hours to the main health facilities still operating in the Gaza.
WHO has said that it has over 2,000 pallets ready for dispatch through Jordan, Egypt, Dubai, the West Bank, and Jerusalem. WHO further warned that current aid remains only a fraction of what is needed to rebuild Gaza's healthcare system. Now for this discussion, we welcome back Professor Andrew Latham. He's a professor of international relations, joins us live from Minneapolis. Thank you very much, Professor, for joining us and staying with us. Now, what's going on with Gaza's aid situation? And also we have seen WHO and many other organizations speak out that these aid kits as well as other aid flowing into Gaza, it's not enough. What will be happening moving forward on this about aid?
Yes, well, it's not going to be enough for a variety of reasons. First of all, the entire civilian medical care infrastructure has been destroyed in this war. Secondly, Hamas has hijacked previous efforts to deliver aid, medical aid, to the Strip. And so that's a problem. It remains a problem. And then, of course, there's simply the infrastructure, the roads and the bridges, et cetera. The hospitals aren't there to facilitate the delivery, both from outside the region and then once it gets to the Strip to the people of the region. So that's problematic as well. So we're going to be in dire humanitarian straits for some time, I think. However, the fact that the aid is being delivered suggests in the broader peace process or talks that momentum is building, that the Israelis are permitting this to happen, that's a sign of good faith on their part, and that's likely to keep the ball moving downfield, as it were, with respect to this broader ceasefire, phase 1 and then phase 2 and then hopefully phase 3 of the peace process. So not enough in humanitarian terms, not going to be enough for some time, but a positive development nonetheless.
And Professor Andrew, from your analysis and all the latest news as well, what do you think? Is there any trustworthy organization that could be trusted for to deliver aid to the people who are in need, the citizens in Gaza?
Well, it won't be UNRWA, the United Nations Relief and Works Agency, which has been captured to a large degree by Hamas and by the Palestinian cause. The Israelis simply don't trust it, nor increasingly does the United States and any objective observer. So the fact that the WHO is playing such a prominent role, I think that's a positive development. It's a specialized agency of the United Nations, to be sure, but it's not UNRWA. So both sides have to have confidence in the organization and the institutions that are involved. And I think to the extent that it is parties like the WHO and other parties that are have a track record of delivering aid in an impartial, unbiased, and humanitarian way, I think as long as both Hamas and the Israelis trust that organization, they'll be allowed to do their work. There will always be impediments, but they'll be allowed to do their work.
And building on your answer, how should Israel or community in Gaza balance the need for humanitarian aid delivery to Gaza with the complex political and security restrictions surrounding this conflict, as well as, like you rightly mentioned, the Hamas taking or using these aids?
Well, the humanitarian in me would like to see as much aid delivered without any conditions directly to the people who need it most on the ground. And that can be things like insulin. Imagine your life if you're a diabetic and you didn't have access to that. It's catastrophic. And then all sorts of other maladies that people suffer. The humanitarian impulse is get as much as possible, as quickly as possible. The realpolitik scholar of international relations that I am says, yes, but what has to be delivered in a way that contributes to the peace process, that doesn't undermine the interests of the Israelis or of Hamas from their perspective. And so there's a political dimension to this as well. And then there's the stark physical infrastructure reality. There simply aren't the roads and bridges and crossings of the border that would allow this aid to be delivered unproblematically. So there are those three impulses or logics at play here, and they're not always pulling in the same direction.
Yes, indeed. Thank you very much, Professor Andrew Latham, for joining us and sharing that insight as a Professor of International Relations from Minneapolis. Now we move on to Asia. Afghanistan and Pakistan's negotiators are set to meet in Istanbul to address security issues and establishing a lasting ceasefire along their shared border after an outbreak of unexpected, intense, bloody clashes last week. The confrontations, which resulted in dozens of deaths among them were civilians, which began 2 weeks ago following explosion in central Kabul, which the Afghan Taliban government has blamed Pakistan for launching a retaliatory offensive. After new clashes that claimed the lives of both soldiers and civilians, the two sides announced a 48-hour ceasefire that quickly collapsed 2 days later, with Afghanistan placing the blame on Pakistan again. A second